Hello everyone, I am Dr. Anjali Kumar. I am the Director of Department of Obstetrics and Gynecology at C.K. Birla Hospital, Gurgaon. So today I will be talking to you people about high-risk pregnancy. Pregnancy, childbirth and labor is by and large a low-risk scenario. But in some patients, this could actually turn into a high-risk situation. This is what we call it as a high-risk pregnancy. So what is a high-risk pregnancy? High-risk pregnancy is a pregnancy which is complicated by certain factors, diseases or disorders which can potentially complicate or affect the maternal, fetal or the baby's outcome. These pregnancies could be as high as present in about 15 to 20% cases of overall pregnancies. These are the pregnancies which actually require special support, specialized care and a good infrastructure to actually ensure the optimal outcome for the mother and the baby. So then let's understand what are the risk factors for the high-risk pregnancies. So the first is actually maternal age. A woman who's conceiving the baby before the age of 17 years or maybe more than 35 years. In case she is having some prior medical condition, like for example, if she is hypertensive or maybe if she is diabetic or she is having some kidney disorder or maybe some heart disease. Now these are the cases where we absolutely advise the woman to consult the medical doctor before and optimize the medical condition before getting pregnant. Then in case a woman develops certain medical complications during pregnancy, for example, if she has what is known as pregnancy-induced hypertension or maybe a gestational diabetes or maybe there is a condition called as cholestasis of pregnancy, whereby because of pregnancy hormones, liver produces certain bile salts which can actually affect the health of the baby. In case the mother is having some kind of a autoimmune disorder, that also is classified into a high-risk pregnancy. In case the pregnancy is complicated by previous cesarean section or maybe certain previous uterine surgeries, in case somebody has undergone some kind of removal of a fibroid which is known as myomectomy. Now this is also taken as the high-risk pregnancy. In case in this pregnancy she is having some kind of premature labor, or in case there is a history of what is known as cervical incompetence, then a woman who has conceived after infertility treatment, a woman who is carrying multiple pregnancies, which is probably she is having twin pregnancy or maybe even a triplet pregnancy. So then what are the complications which we can expect in high-risk pregnancies? So let's divide it into two parts. There could be maternal complications and there could be complications in the fetus or in the baby. So let's first talk about the maternal complications. A mother, in case she is having pain and bleeding in the early pregnancy, she can land up in an abortion or miscarriage. In case she is having an ectopic pregnancy, we can actually need a surgery which may even require removal of her fallopian tube. Later on, in case she develops let's say high blood pressure or diabetes or certain other medical problems during pregnancy, this pregnancy actually can cause the blood pressure to go up, it can cause the diabetes to become uncontrolled, so much so that the patient may actually require a premature delivery. In that scenario, we may require an admission to the hospital earlier than expected. In case we are having a premature delivery, the baby could be born before the time of the birth, the actual birth of the baby. So in high risk pregnancies, actually the cesarean section rates also go high up. The chances of bleeding also becomes high in case of high risk pregnancy. So this woman may actually require blood transfusion. She may be anemic, she may require an ICU admission. Then let's talk about what could be the problems in terms of the baby. Like I said, there could be a premature delivery, so this means that we may have a premature baby coming in because of certain medical conditions like high blood pressure and diabetes. The baby's growth could be affected. We actually call it as fetal growth retardation, which means when the baby is born of a low birth weight. So the high risk pregnancy can cause complications both for the mother and for the baby. So what can we do to ensure that we have good outcomes both for the mother and the baby in high risk pregnancy? So the outcomes actually depend upon what kind of care are we giving to our mothers even before they actually become pregnant. So we call it as a preconception planning. So we actually advise women to come to us for a proper preconception visit, wherein a detailed history is taken, detailed investigations are conducted in case the mother is suffering from some prior disease like hypertension or diabetes, or maybe some kidney or a heart disease, maybe some kind of an autoimmune disease. We make sure that the disease is well controlled, well optimized, so that when the woman is pregnant, she is pregnant in the best of her health. Obviously, this is the time we advise a woman to take folic acid, and we advise them of the lifestyle changes, which means that she should be eating healthy, she should be exercising daily, she should be obviously abstaining from cigarette smoking and alcoholism, and maintaining an optimum healthy weight. Now when she gets pregnant, so of course, needless to say, the mother has to be given a good antenatal care. So which means that she must be coming to the doctor for regular antenatal examinations. In the beginning of the pregnancy till about, let's say, 28 weeks of pregnancy, which is roughly about 7 months of pregnancy, we see a woman generally every 4 weeks. After that, till about 35 weeks or so, or 36 weeks or so, we advise a woman to come to us every 2 weekly. And towards the last month of the pregnancy, we advise her to come to us every weekly. Now, every antenatal visit is a time where we actually examine the woman. The high risk pregnancy has to be delivered in a center which is capable of handling all these cases. High risk pregnancy requires a multidisciplinary support. These are the pregnancies which require an excellent support by the good neonatal department. So high-risk pregnancies constitute as high as 15 to 20% of the total pregnancies. And these days, because of multiple reasons, the number of high-risk pregnancies are actually rising. Even the low-risk pregnancies could turn into a high-risk situation any point of time. So it's very, very important that a good care is given to all women during all stages of pregnancy, starting from the preconceptional care, a good antenatal care, a good care during labor, and obviously an excellent neonatal care to ensure the excellent outcomes for both mother and the baby.